Welcome to Medicine Handy Points. Today, our topic is a very common GI disease, celiac disease. So, let's start the celiac disease discussion. It is basically very common immunological disease which occur because of the gliadin, which is a fraction of protein component of gluten, which is a commonly found protein in a wheat. An immunological reaction occurs to this gliadin, which leads to inflammatory response in the GI tract and leads to villus atrophy and ultimately malabsorption. It can occur at any ages, but usually in babies and in 30s adults can have this disease mostly. It occurs due to the genetic and environmental interplay. So there are some common HLA association. The most commonly involved are HLA DQ2 and HLA DQ8. There are other as well, HLA DR3 and 4, but those are very common. Common diseases which can occur with the celiac diseases, they are type 1 diabetes mellitus, Hashimoto thyroiditis, and patient having dermatitis herpetiformis. These patients should actually be screened for celiac disease. Okay, so now the following condition where the celiac disease screening should be done, like if the patient is having unexplained iron deficiency anemia, that patient should be screened for celiac disease. Chronic diarrhea, patient should get the screening. Persistent GI symptom like nausea, vomiting, uh, should be screened. Weight loss and failure to thrive in the children, or the patient or baby is not achieving proper growth, should be screened. A patient being diagnosed as Hashimoto thyroiditis should be screened for celiac disease. Type 1 patient should be screened, and patient, as discussed earlier, having dermatitis herpetiform should be screened. And definitely, first degree relative with celiac disease should also be screened. Now, the clinical presentation is usually very mild. So, if there is index of suspicion is low, so this disease will be easily missed. So, we should keep mind celiac disease when patient present with GA symptom. More specific presentation are the patient will be having chronic diarrhea, weight loss as a result of malabsorption, anemia because of the iron, folic acid, and B12 deficiency, and skin rashes. Now, how to diagnose it? It will be immunology and biopsy. TTGIGA is high sensitivity and is 100% specific for celiac disease, so we should do that. Duodenal or jejunal biopsy, which may show us villus atrophy, crypt hyperplasia, and intraepithelial and lamina propria lymphocytes. So biopsy should be done to get the final diagnosis. But the important point is that the patient should be off the gluten, should actually not be on a gluten free diet for these tests to be done, because if the patient is on a gluten free diet, these tests will be negative. So if the patient is on gluten-free diet, then reintroduce the diet, gluten diet for 6 weeks before these tests are done. Complication of the disease. So anemia, definitely the patient will be hyposplenism, there will be whole jewel bodies in RBC, osteomalacia because of malabsorption of vitamin D. Malabsorption will lead to a number of malabsorptive symptoms. Lactose intolerance will occur. Subfertility, the patient will be having conceiving, and esophageal carcinoma is a rare, and enteropathy associated T cell lymphoma can also occur if the patient is not treated. treatment. There is no treatment. Actually, they have to avoid the gluten diet, which is mostly found in wheat, barley, rye, oats. So patient should be advised and given a list of food that should be avoided. Gluten-free diet commonly used are rice, potatoes, and maize. The patient can eat these diet. Thank you so much for watching, and please subscribe to the channel.